We'd like to talk about something that affects 1 out of every 2 physicians, and that's burnout. Some of the main contributors to burnout include compassion fatigue, workplace stress, financial challenges, and personal life stressors. We struggle with things like time management, health boundaries, poor work-life balance, and knowing how and when to ask for help. While we would like to believe that we are immune to physical and emotional stress, statistics would suggest otherwise.
At OPHP, one of our goals is to address stress and burnout for healthcare professionals. And we've really taken our time at this point to really figure out ways that we can reduce, if not prevent, physician burnout.
4 years ago, I went through a personal experience of incapacitating burnout. It was such a slow process over the course of several years that I wasn't really aware that it was happening. Both my wife and my scrub nurse suggested that there was a problem, but I, being the invincible surgeon, figured, hey, this is not going to affect me. I should be fine. Ultimately, I had to back away from my practice, take a break, for a short period of time be on medication, and then include some life changes such as slowing down, reevaluating my life strategies, and then involving things such as meditation, changing my diet, exercise, and improving my sleep. With this, I was eventually able to come back to regular practice.
So Jim, looking back at that situation when you were burnt out, and you said it was like a slow progression. Looking back, can you tell us maybe what some of those symptoms look like?
Sure. For me, I think the important part was that there was a change. I became more cynical, I became very irritable, whereas in the past I was able to deal with challenges a lot easier. Suddenly I was overwhelmed. I had difficulty sleeping, I found that I was nervous all the time. But again, the fact that things were different than the way it was before should have been a sign to me that there was a problem. I think there's some embarrassment. I mean, as physicians, we feel that we have to be strong, that we're the leaders. So feeling that we have burnout or admitting it, it's almost like we're giving in. We feel that we've been defeated, that somehow we're not good enough. Those whole feelings of being inadequate come in the way. We're afraid of losing our patient referral. We're afraid of our patients losing confidence in ourselves. And because of that, we try to protect ourselves as much as possible and pretend it's not happening.
You mentioned that you made some changes to your lifestyle. You mentioned exercise and nutrition and maybe getting a little bit more rest. I think you also mentioned to me at some point about meditation. Can you say a little bit about that?
Sure, by all means. For me, meditation, being able to just be with my thoughts and be with my feelings and emotions became very important. Whereas historically I denied that there was anything, that there was a problem. I denied not only that, but I denied all my emotions. So meditation was one of the things that helped me get in touch with my emotions and feel more like a human being.
And being patient with the practice, it sounds like is an important key.
Absolutely. Being compassionate with yourself and realizing that there's not a perfect way to do it. And that eventually you'll get it.
Right. I know I've worked with students for many years, and I talk about meditation and mindfulness and the benefits to it, which can improve concentration. It can actually improve happiness and life satisfaction and decrease anxiety and that self-compassion that you talk about. What's it done for your daily life?
For me, it helped me become more balanced, more able to deal with patients in a compassionate way, being able to listen to them more. And overall feel better about myself and feeling that I'm actually doing something for patients as opposed to feeling that I'm trapped in a situation where I have to do this for them.
So we know that meditation can be really helpful, and we hear a lot about time management as another facet that potentially we should pay attention to. From my personal experience, I think time management really, what that equates to in the professional life is taking time away for yourself, including those good things that you can do, the enjoyable activities. What would you say to something like that? Absolutely.
I think as physicians, we feel that our lives are supposed to be dedicated to patients and nothing for ourselves, and because of that, we wind up being burned out. I think taking time for ourselves includes things like eating well, exercising, spending time with our loved ones, going on vacation. And a very important thing for me was being able to say no. We feel that somehow we always have to be available, so being able to look at somebody or take the phone call and say no, I think is very important.
So for a physician that's been in burnout and now on the other side, what would you tell people?
Well, I think the first thing with burnout is realizing that you have it. and realizing that having burnout is not a weakness, but it's simply something that happens, and that there's plenty of help available.
So we're just a phone call away.